medical practitioners have now drawn up a plan to help them weather the COVID-19 financial storm. South Africa's private healthcare facilities and medical professionals are increasingly being relied upon during the pandemic. Dr. Aslam Dasoo is a member of the Progressive Health Forum. He joins us live. Now, Doctor, good evening to you. It seems strange, but from what I can see, there's been a lot less demand for certain medical services. So I can't imagine many people have had their eyes tested in the last 6 months or any kind of elective treatments. So what's happening to doctors in the private sector and their finances as a result?
Good afternoon, Stephen. Thank you for inviting me. Yes, you're quite right. There is a financial implication of the pandemic that's being felt by the medical practitioners in private practice. And it's principally from three main causes. First is the lockdown, which obviously decreases movement and health-seeking behavior. The second is fear. People have of attending to health centers or doctors, and of course that keeps them away. And then lastly, I think it's the preemptive approach of the private practitioners to empty their surgical lists, empty the wards in expectation of the surge, which was perhaps a little premature, but it's very difficult to predict exactly when that would be. But I think a combination of these factors has resulted in financial distress for thousands of medical practices in the private sector.
So what kind of solutions now on the table? What can be done? I mean, we need these doctors in the system, right?
Sure, and there's over 15,000 of them. So the Progressive Health Forum, which is a network of clinicians, activists, researchers and experts concerned with the state of the health system, at the outset of the pandemic understood that we needed a comprehensive national response to the pandemic, and we weren't seeing that. We saw there was practically zero engagement of the whole private sector, which, as you know, is in many areas better resourced than the public sector and has over half the doctors of the country. And we engaged with the representative organizations to find out how we could get them engaged in the comprehensive response against COVID. What we found was an absolute willingness within the ethical professional framework of doctors to become part of this response. They understand the nature of this health emergency, but were constrained by the financial distress they found themselves in. And so what we did was engage with the Wits School of Governance and the Medical Research Council and crafted a solution for them, which we are confident will enable these doctors to keep their doors open, be sustained in their practices, and be available to assist in the national response.
Is there a role that medical aids play here? I mean, often people in this sector are ending up being paid by medical aids, sometimes not what they wanted, but they are.
Sure. In fact, this is a private sector solution to a private sector problem. Medical schemes have a surplus of contributions because of the decreased demand, and there is a solution in which they can have their risks capped and provide pre-funding to medical practices by using the 2019 claims expenditure data. They have already budgeted for expenditure for this year, which they have obviously not yet reimbursed doctors for because the claims haven't been coming in. So this is a relatively easy thing to do. It's a capitation process whereby doctors get paid up front at the beginning of the month, say, a portion of their expected claims, of their claims in 2019 in the corresponding month in that year. And that immediately keeps the practice liquid. It allows them to pay their overheads, staff, etc., and keep their doors open. This is the most important thing, because then the doctors are available, not only to see medical scheme patients, but as they have indicated to us, even willing to see public sector patients and often pro bono. So this is a necessary step in mobilizing our full health care contingent to meet COVID. As Professor Phillips was saying in your earlier segment, you know, pandemics initiate and accelerate things. This is groundbreaking. It's never been done before to have the entire medical profession at idem on this approach. And it's an important harbinger of trying to get an integrated health system in the future. Now's the time to do it.
So I was going to come immediately to that point. So what this could do then is basically create the roots or lay some of the early bricks, the foundations, for some kind of integrated health system. I mean, I don't know if there are going to be NHI implications in this, but there's certainly change coming.
Sure. And I think that's important. The patient-facing healthcare service provision should be the same between public and private sectors. That has been the abiding dream of health policy in a democratic South Africa. Now, we haven't achieved that for various reasons we can't go into right now. But those legacy issues make it extremely difficult and created a trust deficit, which we worked very hard over the last few weeks to overcome, and to get the doctors in the private sector to stand on one platform with a unity of purpose here, to stabilize their practices so that they can be enlisted in the fight. And in the future, that's how it will have to be with whatever system emerges out of policy from the government and the country.
Dr. Aslam Dasoo, I really do appreciate the time. Thank you very much indeed from the Progressive Health Forum.